Welcome everyone to this explainer. If you're looking to completely master the Ethiopia Malaria case study and secure those top marks in your geography assessments, you are in exactly the right place. Today, we're breaking down this complex disease dilemma with an A-star standard analysis, specifically geared toward hitting those crucial OCR assessment objectives. We're going to unpack the physical systems, the human interactions, and the critical evaluations that examiners are actively looking for.
Okay, let's dive into this. Here is our roadmap for today. We'll cover the Ethiopian malaria dilemma, map out the environmental and human causes, trace the spatial patterns, assess the socioeconomic impacts, evaluate mitigation strategies, and finally, wrap up with a summary of key terminology.
Section 1. The Ethiopian Malaria Dilemma. To nail our AO1 criteria, we first really need to grasp the sheer scale of this communicable disease.
I want to anchor our entire narrative right off the bat with this stark statistic. 60%. 60% of Ethiopians live in malaria risk zones. I mean, just pause and think about that. That is a massive portion of the population constantly navigating the threat of a disease transmitted by the Anopheles mosquito. Having a clear numeric grasp of this scale gives a real-world weight to the dilemma we're analyzing today. And this quote beautifully summarizes the absolute core of our case study. Malaria in Ethiopia demonstrates how environmental vulnerability and poverty interact to sustain disease prevalence. Now, you might be wondering, why does this matter so much for an A-star grade? Well, because top-level geographical analysis requires us to evaluate both the physical and human environments working together as an interconnected system. You just can't look at them in isolation.
Moving right along to Section 2. Environmental and human causes. This is where we apply our AO2 analysis to break down the why and the how behind those statistics.
And this brilliantly illustrates the duality of the problem we're facing. Environmentally, we've got warm, humid climates and seasonal rains creating stagnant breeding water below 2,000 meters. Actually, here's a crazy fact. The Anopheles mosquito only needs a tiny puddle, literally something as small as a muddy hoofprint filled with water, to successfully breed. Contrast that physical reality with the human factors. Rural populations working outdoors at dusk, right when those mosquitoes are most active. Housing with cracked walls and zero screens, delayed healthcare, and seasonal migrant workers. It's essentially the perfect storm of physical and socioeconomic factors. These authentic student notes are an excellent example of how to effectively lay out these exact causes. Notice how they map out the relationships between the factors? It visually reinforces a really vital point. Poverty ultimately reduces access to basic preventative measures, like bed nets. The physical environment provides the habitat for the vector, sure, but it's the human environment that dictates the actual level of vulnerability.
Let's drill down even further into those specific human actions. It's tragic, but daily survival strategies inadvertently increase a person's malaria risk. Farmers just have to work outside, which cranks up their exposure to evening mosquito bites. Families trapped in poverty simply can't afford protective housing screens or, crucially, immediate treatments when symptoms finally appear. On top of that, as seasonal agricultural workers migrate from the malaria-free highlands down to the lowlands for work, they get exposed. Then, they can carry it back, actively altering the spatial diffusion of the illness across the country.
Section 3. Prevalence, incidence, and patterns. Mapping these spatial and temporal distributions is an absolutely crucial geographical skill.
First things first, we must explicitly clarify the difference between prevalence and incidence. Examiners are sticklers for exact geographic terminology. Prevalence refers to the total distribution, so 75% of Ethiopia's landmass is considered malarious, meaning 60% of the population is at risk. Incidence, however, refers to the new cases occurring within a specific time frame. In Ethiopia, we see an incidence of 5 to 6 million cases annually. To put that into a daily perspective, that's a staggering estimate of 1,157 deaths every single day.
Now, what's really interesting about this slide is how it compares the contrasting spatial and temporal patterns. Down in the western lowlands, like Gambela, that warm climate below 2,000 meters provides highly seasonal peaks during the rains. Conversely, the central highlands, like Addis Ababa, are cooler and much lower risk. They only really see epidemics when unusually warm weather allows mosquitoes to survive at those higher altitudes. So altitude and temperature literally govern the disease's spatial pattern.
In Section 4, we shift our focus to the socioeconomic impacts. We aren't just looking at medical symptoms here. We're assessing the severe human cost and the massive barrier this creates for a developing country.
Let's walk through this poverty cycle step by step to really demonstrate high-level AO2 analysis. It's like a domino effect. It starts with the malaria infection. Bam! This immediately leads to missed agricultural work, which severely reduces productivity and lowers crop yields. That loss of income is then compounded by the brutal economic burden of paying for healthcare and transportation to clinics. Finally, this drains household resources, reinforcing inequality and permanently stunting rural economic development. The disease fuels poverty, and poverty fuels the disease.
And the so what factor here, the broader societal impact, is just massive. Children under 5 account for 25% of all hospitalized cases. Their cognitive development and education suffer greatly as they miss weeks of school due to illness. Meanwhile, local healthcare clinics become completely overstretched during those seasonal outbreaks, drastically reducing their capacity to treat any other diseases. This intense strain on both healthcare and education effectively cripples the country's long-term infrastructure.
Section 5. Mitigation Strategies and Evaluation. Remember, a top-tier A-star explainer absolutely must categorize and critically evaluate these interventions. Let's move to and see how this builds our evaluation. We can clearly categorize our strategies into direct and indirect methods. Direct strategies tackle the disease head-on. We're talking over 20 million insecticide-treated nets distributed, indoor residual spraying, rapid diagnostic tests, and artemisinin-based therapies. Indirect strategies, however, focus on long-term socioeconomic improvements to reduce overall vulnerability. Things like health education, improving housing and sanitation to remove stagnant water, building climate-based early warning systems, and forming global NGO partnerships.
But as we know, mitigation is never that simple. Analyzing the obstacles to mitigation is essential for an A-star evaluation. Two major challenges really stand out here. Political instability and ongoing conflicts can disrupt healthcare service delivery entirely. Furthermore, drug and insecticide resistance poses a constantly evolving biological threat that can completely undermine the success of those direct medical interventions we just discussed.
All right, we've reached Section 6, Key Geography Terminology Summary. This is our final checklist of the essential vocabulary that examiners actively hunt for when awarding those top marks.
So, the crucial point is that weaving these exact terms into your arguments is what demonstrates deep AO1 knowledge. Ensure you're super comfortable discussing malaria as a communicable disease. Know exactly when to describe an outbreak as an epidemic versus an endemic baseline. Always reference spatial and temporal patterns when discussing where and when outbreaks peak, refer to the mosquito as the vector, and clearly distinguish between prevalence and incidence when you're analyzing data.
Furthermore, when you're evaluating, use terms like direct versus indirect mitigation. Frame your arguments around environmental vulnerability and socioeconomic inequality. And always bring it back to the poverty cycle and the overarching disease dilemma. These concepts perfectly link human interactions with the physical systems of our planet, which is exactly what geography is all about.
I'll leave you with this final, provocative thought. How do we balance the desperate need for immediate disease control with the vital necessity of long-term socioeconomic development? Master how those two forces interact, and you have mastered this topic. Thanks so much for joining this explainer, and good luck with your continued geographical analysis. You've got this.